We are honored to be joined by our guest, Ken Porter from the Mood Disorders Society of Canada. Welcome, Ken.
Hi,
Welcome.
welcome. Thank you for inviting me.
No problem. Can you go ahead and let us know what your organization does and what your role in mental health awareness is and which communities you're serving?
Yeah, absolutely. So, Mood Disorder Society of Canada is a national nonprofit charity, and our mandate is kind of a national. So we work in all areas throughout Canada. We work with all Canadians from one coast to the other, and actually we do some work internationally with some of our projects as well. But We are a mental health nonprofit, which means a couple different things. That One thing that sets us apart from maybe some other mental health organizations that is that our approach is from the perspective of someone with lived experience. So although we're professionals and we have a lot of things we need to accomplish. Myself, I have a background in social work, but it's the thing that I bring to the table the most to this organization is actually my lived experience.
Yes.
So at Mood Disorder Society of Canada, most of the staff and board members are all individuals who have had at one point their own lived experience with mood disorders of some type. Myself, I battled anxiety and depression since I was a teenager, so that's a pretty common thread. And in all the work that we do, and all the different programs we can talk about, and different services and things like that, it's always from the perspective of the what we call the peer approach. So it's
Sure.
not from the professional, like I said, I've been a social worker for most of my life, but that's not the perspective that I'm bringing to the table here. There's no
Mhm.
difference between me and anybody else. It's just maybe I've got some information and some experience that I can share. But I'm not wearing a white coat, treating you like a patient. It's more of a I'm the same as you. We're on the same page.
For
Yeah, that
sure.
makes you very relatable.
Yeah.
Yeah.
That is great.
That's an important component when you're trying to build a relationship and build a trust, and trying to get people to open up and talk about mental health and mental illness. It's important that it's a approachable and comfortable discussion.
Yes, yes.
Mhm. And that is very key because it's so underaddressed within all populations. It's also underaddressed in our African community. And, seeing that there's so many challenges with barriers to treatment, and it's mainly also centered around this a significant stigma. Mental health shouldn't be talked about. Mental health shouldn't, be it's pretty much shunned upon. That's how I view it within the community. But we want to get it out there, so people know that there's organizations like yours that are there to assist, advocate, and also give other lived experience what co-experience treatments, right?
That's right.
So my question would be, how do your organization, how would you go about educating our community to advocate for these treatments?
Yeah, I mean, you touched on a couple of really important points, and that is that stigma and mental health stigma is very much a real thing. And
Mhm.
and in the general Canadian population, there's still a huge issue. There was one statistics a couple of years ago that says that 80% of mental illnesses are not reported, and so that's a big barrier. When we come to different marginalized populations, that number rises, right? In the immigrant population, especially, facing many barriers there. So yeah, what do we? It's I think we need to reframe the conversation around mental health, and one of the
Mhm.
things that we often say is that mental health is often used as a softer term for mental illness. Um,
Yes.
we often say, "Oh, I have a mental health concern," rather than saying that I have a mental illness, because we're afraid to use that term, mental illness, and
Yes.
reinforces one of the biggest issues that we have is that we refuse to see mental illness as an illness. And it is an illness as much as any physical illness is an illness. So if you had if you had bronchitis or pneumonia, you would go to the doctor and seek treatment and get medication and find a way to get better. Have
Exactly.
a it's an illness, right? And when you approach mental illness from that same perspective, it kind of it takes away some of the stigma because it's not a character flaw. It's not some
Mhm.
lack of faith. It's because you have an illness and it needs to be treated, right? So that's an important message that needs to be shared with all communities. And the way that we address that is, there's a big lack of information in the communities, in Canadian population in general. And so we tirelessly work at producing educational material that that really provides that information on a very easy to obtain and easy to download or an easy to read material. We have different books that we've created, everything from what is depression to medication and you to um, bipolar disorder. There's all kinds of different booklets that we've created in order to provide that information. But we've also worked with professional organizations in order to deliver online training
Mhm.
so that more and more people can understand the impact of stigma. And so everything
Mhm.
in different sectors, like the legal sector and the law and the healthcare sector, and with nurses and each one of those areas that we develop these training programs for, it's designed to kind of introduce that idea that it's okay to talk about this. It's okay to talk about it. Everybody should be talking about this in the same way.
Mhm.
um, Advocacy is another part of the things that we do. um, so we regularly talk to the federal government on issues relating to, budgets, policies, things like that, and advocate for changes in the policies and the amount of money that's dedicated to mental health. So advocacy is a big part of what we've done. And of course, in today's world, getting the message out, the importance of this issue is so important, and social media plays a big part in that. And so we use social media to the best of what we can to get the message out, to share the message of hope that you're not alone, that what you're experiencing is not uh, is something that can be treated, and you can get help, and you will get better. And so that's some of the things that we're doing. But I think that it's important that we understand that mental illness is a very individualized illness,
Yeah.
right?
Mhm.
And so what one person experiences is not necessarily the same as the next person. There are certainly some commonalities, and there's some helpful treatments that are together. But we have to understand that and respect that, right? And not judge people based on what we perceive that illness might look like, right? I know a lot of people who say, you know, "Oh, you say you have depression, but you seem fine," you know.
Mhm. Mhm.
And then a lot of people are, well, you don't seem sad. Why? So you can't have depression. And but there's something called smiling depression,
Yeah.
where you put on a big smile every day, you go to work, and everything's fine, and nobody knows that you're inside, you're battling this disease, right?
Yeah.
So yeah, there's so much work to do. I could go on with all the different programs and services, and just there's a lot to do, but it's really just kind of reframing the ideas and the approaches that we're using.
Yeah. Now, have you noticed any trends, in your data collection? Have you noticed any trends, that are more significant now, given, the current of issues that the world is facing with, COVID pandemic, people losing jobs, people not being able to travel, the isolation. Have you noticed any trends, and what is this saying to your organization?
Yeah, yeah. Right now, at a time when we are so focused on preventing the mental or the physical illness, right? We were self-isolating and we're doing all the steps that we can in order to stop the spread of a physical illness. What we're inadvertently doing is causing another pandemic of mental health. And it's without a doubt that this is something that we will have to deal with and are currently dealing with, but we're just beginning to see the tip of the iceberg, right?
Yeah.
Wow.
Everything from a perfect example would be healthcare workers, for example, right? The healthcare workers who have to go to work every day and face, terminal patients, patients dying, not being able to see their loved ones, not being able to be around their loved ones. And you form your bond with your patients. As professional as you are, you get attached to your patients, and then to see so
Mhm.
many people dying, and the stress that's involved with that, of going to work every day, and then at the end of the day, when you go home, you're constantly worried about bringing the virus to your family. There was lots of of medical professionals who would isolate themselves in their garage or live in a tent in their backyard so that they wouldn't come into contact with their own family. If you think about that extreme situation that people are facing like that, the trauma that that's causing people, like I said, we're just beginning to see that. And you can hear, if you follow this on any news articles, you'll see that there's tons of stories of people talking about this and how they're quitting their jobs, and they had to go on leave. This is a big issue.
You're actually talking about my story because
Yeah.
as a registered nurse, I took stress leave because of the impact of the pandemic and the anxiety that I started to get. And I've never had any illnesses. I've never had any issues with my mental health. But for
Mhm.
the first time in my life at 42 years, I had to face that reality that, the pandemic and the effects that it's bringing. But fortunately for me, I have access to resources, right? And having been a mental health nurse for over 6 years, I no longer work in mental health. I work in I actually worked for a few years in cancer at the cancer hospital. So you still have mental health with people that have significant diagnoses and that are palliative. So mental health is in every aspect and every sphere of healthcare, right?
Mhm.
And I understand mental health, so I'm willing to look for treatment. I'm willing to utilize the resources, right? But coming from a culture where there is significant stigma, and sometimes it's not even recognized as mental health. You know, have you in your organization come across such issues? Have you come across such scenarios where you're trying your best to give resources, to encourage therapy, to advocate for a patient, to advocate for themselves, but they don't even believe what you're saying. They don't think they have anything wrong with them because
Mhm.
of culture.
Yeah, without a doubt, I've come across that in my career, and as an organization, we don't provide a lot of frontline services, but in the work that we do, I've definitely come across that. Um, it's I've heard all kinds of different reasoning when I first bring up the conversation about mental health and mental illness. The whole body language and physical expression changes, because it's like, oh, you step back, like, oh, that's not something we talk about. and
Mm,
and, um, and so I being who I am, I usually just be direct. Oh, why don't you talk about it?
Yeah.
And I get all kinds of interesting answers. And touch on a couple of things that I mentioned a minute ago. When somebody says, one of the most traditional ones is that it's a character flaw, that it's a
Yeah.
sign of personal weakness, right? That there must be something wrong with you because you have this illness, and it's not even an illness. It's just you're sad all the time. They don't even talk about it like it's an illness. They think of it as something's wrong with this person. They're just always sad, or they're acting quote unquote crazy.
No, it's
Um,
a demon.
yeah, yes, yeah, that's the other side of it. Where and that fascinated me when I first heard about that. That oftentimes, sometimes when an individual presents themselves as having symptoms of a mental illness, they're instead of being brought to a doctor, they're brought
Mhm.
to their church or
Priest,
to their temple.
yes.
Right. It's treated as a religious issue that you have a demon, or that your faith is not strong enough. And these are real. Like, I mean, I've heard that story more often than I can count. And it's really it's a lack of education. It's a lack of understanding that what we're talking about here is not it's not a religious issue. If that was true, then mental illness would only affect certain religions, right?
Exactly.
It doesn't. Mental illness is across the board. It doesn't matter what your religion is. It doesn't
Right.
matter whether you believe or you don't believe. It doesn't matter how strong your faith is or how weak your faith is. It doesn't matter. It's an illness, and when you start to see it that way, you start to understand that it's not about faith. It's not about demons or angels or anything like that. It's an illness that needs to be treated. I wish that there was some magic answer um, uh, to kind of wave away this, but it's really education, and the only way to prevent that is to um, is to continue to put out information and education to let people know that this is what we're facing. Um, that what you're facing is a real illness, right? And those kind of
Yeah.
conversations need to happen more often.
You know, a lot of Africans are when they immigrate, they come with a lot of trauma, a lot of there's a lot of cases of untreated cases of depression, anxiety, PTSD, name it, it's all on the board. And w- migrating to a new country, you also have family issues, you have financial issues as well, financial barriers. You're looking for a job and you're carrying all this depression on you. There's so many cases of um, suicide. I'll touch on that a bit. Lots of cases on suicide due to the loneliness as well. Moving into a new country. Have you seen a trend of cases like that within the organization, and how best would you um, assist with resources to people who might be going through something like that?
Well, one of the biggest issues that because of the stigma that's attached to it, and because people are not seeking treatment, and because oftentimes it ends in a tragedy,
Mm,
that the double tragedy of that is that we're not collecting the data. We don't understand what caused this to happen, right? And so when we're not reporting it, when we're not talking about it, there's an invisible problem. I have tons of anecdotal information where people tell me things, but if you look at Statistics Canada's website, and I went to there just out of curiosity,
mhm.
and according to the statistics, the mental health and of immigrants is significantly better than that of the average Canadian population.
Mm,
And
nice.
and now you can tell me whether or not you agree. I might challenge that. I don't have any data to back it up. It's just my own
Yeah.
anecdotal information. But I might challenge that and say
The
I
truth,
think there's some that's underreported.
yes,
Y-
that's what
y- you,
it's underreported, and
yes.
I think it's not captured. I think it's not captured. I think we're missing an opportunity to capture it. Because I think that as soon as an immigrant comes, say they're coming from, a war zone, for instance.
Mhm.
Got so many immigrants, and Canada is very, very, good at that. Like, we're one of the countries that are recognized in accepting immigrants from, you know, disastrous places in the world, right? Those
Lot of
people
trauma.
are coming with trauma. That is a fact
Mhm.
already known. you know what they've seen, the death they've seen, the fighting they've seen, they've lost their loved ones, they've lost their livelihoods, and they're coming to a foreign country. Sometimes they don't even speak the language.
Mm.
And are we failing to capture the mental health issues that these people are carrying with them and failing to address them as soon as they get here? These are the resources, this is where you can get help, you know, um, and it might be a funding issue. I really don't know as well, but to say that.
It's past the card. It's past the card. Here's the phone number. It's now up to the individual to seek that treatment. So it's a choice, right? That's the options that as immigrants we are mostly given is here's a psychologist for you. Take the number, give them a call. Let's see, because I've told you my story. I'm coming from a war zone. I've told you my story. So of course there's mental health, like there's some trauma there, you know what I mean? So now the thing is, am I comfortable enough as an individual to share myself and share that information again? I've already come to Fifi and I've told Fifi my story. So Fifi, like, so I don't know, Ken, help me out here.
No, well, it's true. It's true. And in settlement services, there are a lot of different services that are offered to new Canadians when they arrive, and but oftentimes it's not specific, right? It's more generalized information. And you're right. If somebody says, "Oh, first of all, they wouldn't say that I need to see a psychologist. They wouldn't say that. It's up to the person that they're talking to, their settlement counselor, whoever it is, the immigration
Exactly.
officer. Somebody at some point would have to pick up on the fact that this is needed, and it should be offered in a way that encourages people to come forward and to talk about it. But that's very difficult, as you stated. You're coming into a new country. You're already apprehensive about bringing yourself into this new culture, into this new language, and into everything new. And the first thing you're going to do is to talk about all the bad stuff that happened to you. Most
Exactly.
people, most people don't, and that's a problem, because when you don't treat mental illness like any other illness, if you don't treat an illness, it gets worse,
Yeah.
Hmm.
right? So yeah, we need more intensive care, uh, at the beginning. Intensive care is an odd word, but you know what I mean. We
Yeah.
need more help as Canadians, as immigrants come to Canada, especially refugees, who are coming from terrible situations. We There needs to be some services in place um, to allow them to access that type of help on a very comfortable level, and a non-confrontational level, and a non very, like I said about the peer approach, is
Yeah.
very important, right? If I'm talking to you wearing my white coat, right, you're less inclined to tell me things because I look like this official, person. Whereas if I'm talking to you with just my sweater, and I'm sitting down, and I'm talking to you with my jeans on, I'm just a friend. I'm just a friend talking to you, right? And it's that approach that's so important. In immigrant populations, I think one of the untapped resources that could be used more often is peer support. Um,
Mm.
I think that peer support is one of the best ways to address issues that in a very effective and efficient way, where you have somebody who's lived through the same experiences
Yeah.
or similar experiences, and they receive some training that helps them to help others who have been through that experience, right? So by helping themselves, they're helping others, and so it becomes a circle of help, and it's where everybody understands that that together we can get better. It builds a sense of community.
Yeah.
You know what I mean? That's what I would really like to see more of, and in the mental health
Does
community,
such a
oftentimes.
program exist?
Pardon me?
Does such a program exist?
Not that I'm aware of. No, no, but it's something that I think that should be done. I mean, we are our peer support program that we offer at Mood Disorders is groundbreaking. We're one of the areas that we were the first to touch on is in first responders, police officers, military, things like that.
Mhm.
But we reached and we started branching out because it was a demand. And one of the areas we now do a peer support training session specifically for the LGBTQ population.
Mhm.
So it's because that was where the need is. But maybe there's like 'cause definitely a population that needs to have that address as well in the new immigration in the new immigrants population. And if you want to get specific to that, right? So maybe that's something we should talk about a little bit further about. Where there's an opportunity to develop some peer support programs in different groups in different
Mhm.
different uh, neighborhoods.
That's really amazing. That is really, I think you touched on a very good point with the peer support program, because I was about to ask you, like, what other unconventional ways do you think people should resort to for coping within your organization? And also, like, is there an increase of self-reported cases that you have noted, within the African and immigrant population?
Yeah, like I said, I don't think I have any statistics that I can really point to. It's all anecdotal information that people have told me. And like I said, that comes back to the underreporting problem, right? And oftentimes we'll find out about the illness through what we call comorbidity, where it comes up in a different illness, right? So
Mhm.
you develop arthritis, and as a result of the arthritis, you have depression. But then there's also the opposite, where you start to develop physical pain as a result of having depression. Just an example. You know what I mean? So there's some the connections between physical illnesses and mental illnesses that are
Yeah.
often happen, and they're quite common in most illnesses. We did a whole project a few years ago, focusing on the connection between arthritis and depression. And Yeah, and that's something that we're exploring more right now. Uh, the disruptions in sleep and how that affects mental health.
It becomes this infinity loop, right? Because depression increases that lack of motivation to treat the
Makes
physical
sense.
symptoms, and those physical symptoms get worse, and that causes the depression to get worse.
Yeah,
This infinity loop of you know just functional decline, right?
yeah, yeah.
Yeah.
Well, yeah, absolutely. It's that connections between all the different illnesses, and so we're not reporting, we're not talking about it. We're burying it and putting it in someplace else, and it doesn't go away. It comes out in another form, right? Either a physical illness or all kinds of different ways that it can come out, but it will come out. I mean, you cannot hide it. An illness needs to be addressed, right?
Yes, for
Um,
sure.
so I mean, one of the most important things is really, one of our campaigns we do is defeat depression, and that's a campaign that provides direct support to mental health programs across Canada in all kinds of different sectors. And fundraising is an important component of what we do as well, because there's a lots of programs out there, like even this, say for example, hypothetical peer support program. The next question would be, where would you get the money to run it,
Yeah.
right? And so we run the defeat depression campaign specifically to help programs like that to develop and to build up and to be able to offer more help to more people. um,
That is amazing.
yeah, and we work with multiple partners across Canada and different organizations to try to address the needs of various groups. And I think that if we're all kind of working together towards a common goal, that we should do that. Oftentimes people get competitive about who's doing what, and honestly, there's more than enough work to go around. So let's work together and try to make this a little bit better. Um,
That's
but probably one of the most important things, and it seems simplistic, but honestly, talking about it, right? Having open conversations about it. I know that when I talk about my battles with my anxiety and depression, it took me years to become comfortable talking about that. As a social worker, somebody who spent all my time helping others,
Mhm.
I was told you don't disclose, you don't talk about your own illness. So it was very, very deep. It wasn't something I ever talked about. So I first had to do a presentation in front of 100 people talking about my illness, and all of a sudden, um, it's a real thing, right? And so sharing that conversation and talking to others and encouraging others to share their point of view is very, very important.
Wow. No, this was very insightful, Ken. Thank you so much.
Yeah, we
No, thank,
appreciate
thank you.
for your visit to our podcast today. Now, can you tell us where people can reach you if people want to make a donation, where they can make a donation to?
Absolutely. So I work for Mood Disorder Society of Canada, and our website is mdsc.ca. And you can find the a place to make a donation there. But I would encourage everybody to get involved with a local Defeat Depression event. We have events happening across Canada, and we also have virtual campaigns happening this year. So no matter where you live, you can participate. Go register and help fundraise and support local mental health. You can do that by going to defeatdepression.ca and finding a location near you. I really encourage you to do your best, and most importantly, have those conversations. Even though they might be awkward to start off with, have those conversations.
All right. Well, thank you so much for joining us today on this episode with Ken from the Mood Disorders Society of Canada. And as you heard, please try and participate in the Defeat Depression campaign. You can look it up. The website is defeatdepression.ca, and
Yes.
participate, do your part, talk to your friends, talk to your family, get the help that you need for any mental health issues before it's too late. We will see you in our next episode. Ciao.
Yes.
All right. Thanks, everybody.
Thank you.
Thanks, Ken.